Welcome to the video on Healthcare app developed on Salesforce CRM. As the healthcare industry is shifting towards more patient-centric model, the specialty healthcare companies aim to reduce the cost while improving the quality of care. The data coming to a healthcare industry is enormous. This healthcare app is explicitly created for accountable care organizations, commonly referred as ACOs, and which is a part of Obamacare to improve the quality of care in the United States. It is a network of physicians and hospitals who agree to take responsibility for the care of a defined population of patients while assuring active management of both quality and cost of care. To participate in the shared savings program, a healthcare organization should become an ACO, and it must meet a couple of requirements, and one being that it should serve at least 5,000 patients for a period of 3 years. According to NCHS, or the National Care Health Statistics, the average number of times a patient visits a physician is 4 times a year. On an average, the number of details to be recorded related to a patient, which includes medications, vitals, problems, lab orders, allergies, etc., would be around 25. Therefore, on an average, the number of records to be handled by the smallest ACO would be around 500,000, and that of a medium ACO would be 1 million, and that of a large ACO would be definitely greater than 5 million. From these calculations, we get a clear picture of the enormous amount of data coming up from the healthcare organization. In our healthcare app, our key entity is the patient, and we have other entities related to the patient like medications, vitals, problems, order results, providers, payers, etc. A patient can have multiple vitals depending on the number of times the patient visits the physician. Similarly, a patient can have multiple problems, medications, lab results, even providers or physicians. A powerful CRM like Salesforce can easily handle millions and billions of records. Apart from this, Salesforce also has extensive analytical capabilities. You can create real-time personalized reports and dashboards. Center for Medicare and Medicaid Services, or CMS, measures the quality of care provided by an ACO based on which the ACO gets paid. The quality of care is measured using 33 nationally recognized measures in 4 key domains: patient or caregiver experience, care coordination or patient safety, preventive health, and at-risk population, which includes the patients diagnosed with diabetes, hypertension, ischemic vascular disease, heart failure, and coronary artery disease. Now let's consider a use case. This use case is one out of 33 quality measures set by the CMS to analyze the quality of an ACO. This quality measure checks the percentage of patients aged 18 years and older and whose recent BMI is outside of normal parameters. The CMS has divided this use case into 2 parts as denominator, which gives all the patients aged 18 years and older at the beginning of the measurement period, and a numerator, which gives all the patients with BMI outside of normal parameters. On dividing numerator by denominator and multiplying it with 100, we get the required percentage. Now let's take a look at the way this quality measure has been evaluated in our Salesforce app. In our Salesforce app, we have used Apex class along with visualforce pages with minimal coding to obtain the result of this quality measure. Let's have a look at the result. So this quality measure gives us the percentage of patients aged 18 years and older and whose recent BMI is outside of normal parameters. Out of 4,000 patients, which is the total number of patients in this application, there are 1,738 who are aged 18 years and older and who has recently calculated BMI, out of which there are 1,680 patients having BMI outside of normal parameters. Dividing the numerator by denominator and multiplying it with 100, we get a percentile of 96.66%, which is the required result. Thereby, we can solve complex measures using simple coding, which is a highlight of Salesforce. Similarly, we can create other measures too. Here there are 18 out of 33 measures. Let's see one of them. ACO report 21 gives us the percentage of patients aged 18 years and older and who were screened for high blood pressure. Out of 4,000 patients that we have in our application, there are 244 such patients, which gives us a percentage of 12.55%. Apart from the ease to handle millions and billions of records and the extensive analytical capability of Salesforce, it also helps us to build rich interfaces and sophisticated processes using Apex and Visualforce languages along with HTML. Collaboration using Chatter is automatically a part of the application. As Salesforce is SAS70 Type II certified and HIPAA compliant, it ensures security of patient data on the cloud. With Salesforce, you need not compromise quality of reports or services for the quantity or number of records, be it 100, 1,000, 1,000,000, or even greater than 1 billion. Thank you.